Losing over 100 pounds is an amazing accomplishment, but there are some things then you need to look at with the body. And I have with me some help. Dr. Rick Izquierdo is here with me to talk about skin solutions. What do we do when we've lost over 100 pounds? What parts of the body are going to need your help?
Well, Andrea, what happens is that that skin has been expanded for so many years. Once you lose that weight, it doesn't retract. So you basically have hanging skin. We call it an apron. Some patients call it bat wings in their arms, or even the skin between their legs. So basically, it's an excision. And for example, in the abdominal and truncal skin, that skin is removed circumferentially all the way around. So they essentially get not just a tummy tuck, but what we call a body lift.
So they feel a lot better about themselves as well then. And that's part of why we want to speak to you as well about empowering yourself and feeling better when we make some small changes with the body, being weight loss or cosmetic surgery. And tell us about maybe the non-surgical ways to change that.
Well, there are so many new approaches to what we can do now with non-surgical means. For example, the lines that we see around our eyes, the lines that we see on our forehead, the lines that we see in the grouchy lines is what I call them. Those can be treated with simple injections of Botox. It lasts 3 to 4 months. You get a smoothing effect of those areas, and you really don't look any different, but you don't have those lines that reflect a different or older, tired look.
So first step might be then, you said injectables. What's the next line that you might end up trying?
Well, beyond Botox, we have other injectables that, for example, can fill out areas that have lost volume. For example, the nasolabial folds, or sometimes the cheeks even can be filled. So those can be done subtly, and I know we've seen over the years on the magazines and on TV people that are overdone. But what we try to do, and what I think the state of the art is to make people look natural and refreshed, not a whole lot different than they usually are.
And typically this tends to be female clientele, but male clientele as well.
Absolutely. We have probably 5 to 10% are male customers, patients, and that is growing.
And I think that's important to know, because when we talk about feeling good about ourselves, everything from the inside and out is reflected. So when we feel better about ourselves on the outside, we can make better changes on the inside, like a healthy diet. Tell me a little bit about how long it takes for the skin surgery or reshaping the body after a significant weight loss. What's the timeline for that?
Well, usually what I like to see is that the patient is going to be within 10 to 15% of where they want to be weight-wise, because that way we can really form them to what they want to be. The procedure for the body lift, for example, where we take off all of the abdominal skin and tighten up not only the abdomen, but also the tush, which comes up, probably takes anywhere from 3 to 5 hours, depending on what has to be done. The patient has to be first done on their back and then on their tummy to get the back part done. So it's an extensive operation. However, they do quite well with it. It's totally external. We give them pain pumps that help with their pain, and within 2 weeks they are up and moving around rather well. Liposuction entails removal of pockets of fat. I think it's been extended a little bit to remove more than just pockets, but in a person who's fit like you, some patients will have little pockets that they just can't get rid of. And classically, in males and females, it's a little different. But the liposuction will contour those areas to give them decrease waist size, decrease butt size, or what people call the saddlebags. Those patients who are in good shape are usually our best results.
Well, I think this is so interesting. And again, it comes down to empowering yourself, because if you feel good about yourself on the outside, then you're going to feel good about yourself on the inside. And that comes from good nutrition, great exercise, and of course, taking care of your skin and mental health. People are always asking me, what's the best type of exercise? And I tell them it's the one you like doing the most, of course. Exercise is really a 3-part program. It's about your heart, your muscles, and your joints. And that translates into cardiovascular training, strength training, and flexibility training. Well, if you like to walk, run, jog, do the stairs, or even the elliptical, there is a piece of equipment that you can purchase or use called the Precor AMT. This has it all. It's called adaptive motion training. So even when you like to walk, the machine will walk with you. It'll actually fit your motion in a low impact environment. It has a low entrance accessibility, and if you like the elliptical, it can mimic that movement pattern as well. If you like doing stairs, you'll get more hip extension and work the backside a little bit stronger. And of course, if you like to jog, you can always pick up the pace. The other nice touch about this is Precor has a 10-year warranty on this piece of equipment. So although it is a hefty purchase price, you'll find that you'll have it for more than 10 years, and then it covers every piece of cardiovascular equipment. In regards to strength training, free weights are probably your best option because they teach the body balance, coordination, and improve the muscle tone. Don't forget about flexibility training. It's not just about stretching, but it's working on the weaker muscles on that side of the joint. So it's three parts: your heart, your muscles, and your joints, and those translate into cardiovascular training, strength training, and flexibility training. 3 parts for a Fit Today program.